Are you thinking you might have an eye infection? Well, in this video, we'll explain the next steps you need to take right now, coming up. So the disclaimer here is that watching this video doesn't create a doctor-patient relationship, and the treatments discussed and the information provided should be applied at your own risk. And watch until the very end of this video for a special pro tip if you suffer from chronic eye infections or chronic eye irritation. In previous videos, we talked about the differences between the different types of eye infections out there and how eye professionals and professional eye care providers can tell the difference between the different types of eye infections. For example, a bacterial eye infection looks different than a viral eye infection, and both of those act differently than an allergy-related eye condition. The links to my favorite eye infection-related videos will be in the description below if you decide you want to check them out after this video. Now, it's true that most eye infections cause red eyes, but not all red eyes mean an eye infection. But what are some do's and don'ts if you think you have an eye infection? I've been practicing optometry in the state of Utah for over a decade now, and I definitely have seen people that have made some smart moves when they've suspected an eye infection, as well as some not so smart moves. When you get an eye infection, a lot of questions can go through your mind, like, if I don't do anything, will it just go away on its own? Should I go to the pharmacy and try to find some over-the-counter eye drop to make it go away? If I have an old bottle of antibiotic eye drops in the fridge that my kid used last month for their eye infection, can I just use those drops and will it just go away? Or how contagious is it? Should I stay home from work or have my kids stay home from school if they have an infection? These answers are really determined by the type of eye infection you have and how severe it is. Where we can really put the eye at risk of permanent vision loss is if we have a serious vision-threatening eye infection that's either inside the eye or involving the cornea, which is the clear tissue that sits directly in front of the iris, right underneath the contact lens if you wear contacts. So let's talk about the first question. Will my eye infection just self-resolve if I just ignore it? What I would say that while it's true that our bodies do have a built-in immune system and can self-heal in many cases, I would remind you also that it's sometimes hard to know how severe an eye infection is without your eye doctor first using a special diagnostic dye on the surface of the eye and then looking at your eyes behind a special microscope equipped with a cobalt blue filter and something called a Ratten filter, and possibly even the ability to snap a photo of the surface of the eye as well. A simple temporary diagnostic dye can let the eye care provider know the right medication to use for your eye infection. These tools and more are all used literally every day at my different practices. But is it possible that an eye infection can self-resolve? The answer is yes, it's possible. A minor eye infection, even certain types of viral infections like the kind that we get when we have a cold, for example, can self-resolve. Obviously, an antibiotic eye drop won't help much if the eye infection is caused by a virus. So in most cases, it's still critical that you see your eye care professional if you suspect a serious eye infection. A more serious eye infection like a corneal ulcer or a contagious pink eye or post-surgical eye infection could lead to a serious vision-threatening scar or even total blindness. Some symptoms of a serious eye infection might include eye pain, redness, decreasing vision, and severe light sensitivity. These might be some indicators of a more serious vision-threatening eye condition that would need to be taken care of with your local eye care provider. But what if you have some old antibiotic eye drops in your fridge that you or somebody else in your family used months ago for their eye infection? Are they safe to use for your eye infection? It's a possibility that they could help, but they'll most likely be less potent, and if they're old enough, you're running the risk of using expired eye drops in your eyes that could lead to a different eye infection or could delay healing of the original eye infection. Plus, if the last person using those drops accidentally touched the tip of the dropper to their eyelids or the surface of their eye, you're running the risk of picking up whatever they were infected with. I also want to throw out there that we as humans not only get the most popular eye infections like conjunctivitis and pink eye, but we also get these little mites that actually live in our eyelash follicle called Demodex. And these pesky little mites are not only found in third world countries, but all over the world in the most advanced countries, including the United States. I find them on my patients quite a bit, so you really want to avoid using anything that someone else has used on or around their eyes, including old antibiotic eye drops, makeup, stuff like that. Besides, these days the cost of antibiotic eye drops can be quite low now. It's worth taking the time to pick up a new, unused prescription bottle and using that one instead of the old bottle. I say prescription bottle because there are companies out there that sell over-the-counter products that claim to give you relief from conjunctivitis and pink eye. But I just want to caution you about using those products because eye infections can be caused by different types of microorganisms and different types of bacteria. For example, there's gram-positive and gram-negative bacteria. And as prescribing healthcare providers, we have to be in tune with our knowledge of these different types of microorganisms in order to prescribe the most correct and most applicable antibiotic drop. Avoid using over-the-counter eye drops if you suspect an eye infection. If you feel like you're getting value out of this video, take a second and smash the like button for me. It helps me know if I should make more videos like this in the future. But is there anything a person with an eye infection can do at home to help with these symptoms of an eye infection? Yes, there's a number of different very good things that are not only safe to do at home if you suspect you have an eye infection, but that might even help your infection resolve even faster. Increasing your lid hygiene can ensure that healing doesn't take more time than it needs to. Daily lid scrubs remove dust, pollen, and bacteria, as well as foreign materials from your eyelids and eyelashes. I always tell people that our eyelashes are just filters. You gotta keep them clean every single day. I'll have links in the description for my favorite products that I use on my own lid routine at home, as well as links to videos that demonstrate the best way to do lid scrubs. Practicing better eyelash and eyelid hygiene doesn't mean that your eye infection will go away, but it can speed up the recovery. Just make sure that if you're cleaning your lids and lashes on one eye, be sure not to rub the other eye with the same hand that you used on the infected eye. So if you have an eye infection, should you avoid people? The most accurate answer to that question would be based on the type of eye infection you have and how severe or contagious it is. So until you know, use your best judgment. Keep some hand sanitizer close by so you can keep your hands extra clean during the eye infection. Don't touch the infected eye and then touch the other eye, and avoid shaking hands until your eye infection resolves, or at least until you know the severity of the eye infection. And if your eye or eyes are pretty red and you suspect that the infection is contagious, it would be wise to avoid going into work or going into public places until your infection has resolved, and your eye care provider will be the best person to answer those questions more specifically. Now here's that pro tip I promised to tell you about. I think it's important for people to know that just like our teeth have biofilm that grows on them, creating the need for periodic teeth cleanings, our eyelids right at the base along our lash line especially also contain a biofilm that often causes not only chronic redness and irritation, but occasional eye infections as well. Sometimes as eye care providers, we recommend that our patients come in for a treatment where we gently remove this biofilm in order to treat and prevent chronic eye irritation and infections. This is something I get done on myself a couple times a year for ultimate eyelid hygiene and actually contact lens comfort improvement. One great way to relieve your eyes from chronic eye redness is to get your eyelids deep cleaned annually. And I'm here to tell you that it doesn't hurt. It can tickle quite a bit during the process, but will leave your eyelids feeling very refreshed afterwards. Patients often tell me that in the weeks following their eyelid biofilm removal, that they notice that their blinks are much smoother and the whites of their eyes look less red in general. Talk to your eye care provider to see if they perform this routine procedure. Having this done by your eye care professional can help quite a lot if you deal with chronic eye irritation or chronic eye infections. To illustrate the important subject of proper eye treatment during eye infections, I'm going to read a short story. Once upon a time, there was a young man named Mark. Mark loved spending time outdoors and often found himself exploring the beauty of nature. And one day he woke up with a red, itchy eye, but instead of seeking immediate medical attention, he shrugged it off, thinking it would go away on its own. As the days went by, Mark's eye infection worsened. He experienced intense pain, blurred vision, and sensitivity to light. However, he ignored the warning signs, believing that his body would eventually heal itself. Unfortunately, his assumption couldn't have been more wrong. Weeks turned into months, and Mark's eye infection persisted, gradually damaging his cornea permanently. By the time he finally decided to visit an eye doctor, it was too late. The infection had caused irreversible damage, leading to permanent vision loss in one eye. This object lesson serves as a reminder of the importance of seeking timely medical attention. Just like Mark, many of us tend to underestimate the severity of certain health issues, hoping that they'll resolve themselves. However, this story highlights the risks associated with neglecting medical care, especially when it comes to our precious eyesight. Remember, our eyes are delicate organs, and any signs of infection or discomfort should be taken seriously. By promptly reaching out to a medical professional, we ensure that they can diagnose and treat the problem before it progresses, potentially saving our vision from irreversible harm. Let this cautionary tale serve as a reminder to prioritize our health and never take our eyes for granted. Remember, if you suspect that you have an eye infection right now, it's crucial that you seek professional medical advice. Most serious eye care clinics will get you in same day or next day if you explain to them that you think you have an eye infection. So this video has attempted to provide some general information, but everyone's situation is unique and different. If you like this video, you'll definitely want to watch my next one, where I'm going to share with you the exact steps that I take on my very own eyes when I start to have an ocular allergy response, like itchy eyes. Thanks for checking us out on YouTube, and we'll see you in the next video.